special week 50. We are in the midst, I guess, at the tail end of wrapping up our Native community vaccine event at the Gerald L. Ignace Indian Health Center, where for the past 3 days, we have been vaccinating the Native community of Milwaukee County, 18 years of age and up, as long as you were an enrolled tribal member or descendant. And to say the least, I think it's been a successful event. Of course, Dr. Ignace will dive deeper into this in the presentation today. If you have joined us here before and you are on via Zoom, you can leave a comment or a question in the chat bubble at the bottom of your screen. If you're joining us via Facebook Live, just drop in a comment and let us know what you're thinking about, what's going on in your community, what questions you may have. And to help us along with some of those questions, as well as bring some questions of his own from his community interactions, is our good friend Mark Denning, who's been with us here for, I would say, pretty much all 50 weeks. So thanks again for being here, Mark, and I will pass it over to you.
Buju, Nadawe Benezi, Indigenous, Namayan Dodem, Anishinaabe and Dao, Neopit and Donjaba. Welcome, everybody. It is with better news that we're coming to you this week. And I am just as passionate as I was last week about getting the word out there and the challenges that our community faces. If you're watching this for the first time, if you move your cursor around, or if you have a mouse, one of those, you can move that around, an arrow or hand will appear. And on the bottom side, top of your screen, you'll see a bar. In that space, in there, that kind of lighter black bar, there you'll see commands. And in there, you're gonna see a chat. That sometimes people call them a chat bubble. Looks like if you see an old time cartoon figure, it's or a thought bubble. If you just press that, and a screen will appear, and you can put whatever kind of question that you might have, or some kind of greeting, or you know, if you think that you're hearing something that you like hearing, you say, yes, please, more of that. Please do that. There's different ways we communicate. Some are really good with spoken word, some with writing. In others, we know we need other people to speak for us. And that's why we're here. A lot of the folks that are on this have the ability to be on a computer. You have the ability of having access to internet, and you have the luxury of having time to be with us during a workday, or maybe some of the second, third shifters are checking us out. And we have a responsibility to be asking questions on behalf of the people that aren't here. So that's just enough of my buildup, and then towards this. We have a health issue. We are in the midst of a pandemic, and that word has not left the vocabulary of our medical establishment nor our communities. And we're in the midst of it. I know there's a lot of hope. Spring is outside. In the native to native conversation, Longhouse people, I know Anishinaabe people together are looking at our trees for those good messages, that life that's flowing, beginning to move through them. A lot of our folks are out there with maple syrup camps, helping make their lives, making some money for themselves and their family, or just sustenance to get them through the year, to add to their diet. So that blood of our trees that's emanating back and forth in the springtime, it's also that way with us. That life force gets energized in us, that we feel that presence of something's different, something's alive, there's more motion, there's more sunlight. All of those things are going on. And then we're looking at, I know Dr. Ignace just spoke about being excited about opening day in baseball. We have Cinco de Mayo for some of our relatives out there in a month or so, and then St. Patrick's Day right around the corner. These are all places that can become super spreader events. These are all places where someone who has the virus doesn't know they have it can be spreading it. And there is a laxity out there that we need to address in our communities. And we're seeing it right now. Hosting of powwows, hosting of ethnic events where we're going to host it, or we're only going to allow so many hundred in, and they let 1,000 in. And we're seeing posters come out there. Next week, there's going to be a powwow. Week after that, week after that. It's like after the first one, now it got easy. Are we asking ourselves, if I map that event, is that host with contact tracing going to let me know that the virus was there? And if you're only a week or two into your vaccination, it doesn't necessarily mean you're going to be okay. We need to be thinking about this. We need to be talking about it. We need to be pressing our tribal leaders on this issue. And that's why we have Dr. Lyle Ignace here. And they're doing some very special work at that center here in Milwaukee. So without further ado, and listen, please think on the thoughts I shared with you. Dr. Ignace is going to be talking to us about COVID-19 today in this native to native conversation. Dr. Ignace?
Thanks, Mark. You bring up some pretty salient points, and really talking about getting back to that normal, that level of normal that we all enjoy, those social events, those traditional gathering events, ceremonials, and really taking that opportunity to get back what we as Native people enjoy, what we look forward to, what we take as part of our yearly cycle of activities and events, and this includes family. You know, this includes who we are as people in the day-to-day and month-to-month, to activities and traditions that we have been longing for over a year now. And this week really does kind of put things in perspective. I've been approached several times to ask, can you give me, what's the year in review have been? Because this marks literally the week from a year ago, how things dramatically changed for all of us, in particular for Native people, in the ways that we were accustomed to doing. Things changed, and it changed in a matter of weeks. Everything did. So looking forward, knowing that vaccines have now are now part of daily conversations, as Mark was talking about, seeing as spring approaches in the cycle of life, and how we as people enjoy seasons, enjoy new cycles, and that life moving forward. We, at the Gerald L. Ignace Indian Health Center, approached this knowing that this year mark was coming, knowing the impact of how COVID has been for Wisconsin natives and here in Milwaukee. We actually created this event, the event that has taken place this week, Tuesday, Wednesday, Thursday. Now, what was particularly interesting about this is that we had set out, and I'll just let you know that we originally set out to do 360 vaccines, and our criteria at the time when we started this was to include individuals that were in 1A, 1B, 1C, and obviously you needed to be tribally enrolled or at least proof of descendancy. But we were focused on the Milwaukee County area. We wanted to make sure that we addressed individuals that were at high risk, specifically with an underlying chronic condition. So 18 and older. We were using Moderna, so that was the age requirement of 18 and older. And we had a good response. We had a lot of individuals that had underlying health conditions that fit into one of these categories, and we were scheduling people, and we had the opportunity to connect with our local news media, and there was a lot of response. There was a lot of positive response and circling word around this event, because this was quite unique. It's unique in that not only is it specifically just for natives, but it was criteria that was outside of the state. And that was intentional because the impact we know does affect disproportionately for minorities, but this is specifically natives, and we needed to address and find a way to intervene how we can reduce not only the case rate, the hospitalization rate, but also the fatality rate. So we got our local news media, channel 4, 6, 12, 58, Spectrum News. They were all involved. Journal Sentinel was involved, and several other news outlets. So once we started hitting the airwaves, the response grew almost immediately. And we were originally scheduled to do 360, but because the request, the demand for getting a scheduled appointment was quickly exceeding 360, and as of today, we'll have been able to give 460 vaccines to natives who reside here in Milwaukee County. So this is a big deal, because this is really about opportunity. This is really about access and really intervening in this cycle of transmission of the virus and protecting our native community. And so this was a very important event, and one that I'm proud to have supported and implemented, and it's been such a success and such a demand that we're actually looking at establishing another event, another 3-day event, and it's going to happen really soon. I don't want to get too far ahead, but I have been in contact to address the specifics and the logistics of another 3-day event, and we'll be promoting and getting that information out really soon. So the criteria will change a little bit, so we want to be more inclusive, and but I will give those logistics out maybe as early as tomorrow. So if you have registered online or called and we're not able to get an appointment, be patient. We're going to do a second round. We're going to do a second event to get and make sure that people that want the vaccine, that we are able to get that and deliver that for you. So do pay attention to an announcement that's probably going to come out in the next 24 hours of when this is going to occur. So we're working on that right now. So now I know people know the side effects, and the vaccine that we've been offering here, it has been Moderna. And but I wanted to give you, as part of this event, people may be wondering what their side effect may be. Some may have very mild ones, and maybe just some local arm soreness and maybe a little fatigue. But this is the full scope of side effects that people can expect, or at least possibly develop over a 2-day period. And they tend to be mild to moderate. Rarely have I seen anyone have severe side effects, but this is at least to be anticipated what could possibly be as a side effect for you if you get the Moderna, as well as the Pfizer vaccine. So what does this mean when we do get vaccinated? Does this mean a take off my mask, I'm good to go, no problems. Well, yes and no. You just can't do that just yet, mainly because we're still in a pandemic. We still have infections. There's still virus floating around. So, but what does it mean to be vaccinated? And I think this is really a good opportunity because, we talk about vaccines, but what does it mean after you get the vaccine? What does that mean for me or my family? Now, the guidance that came out earlier this week would be for individuals that have been fully vaccinated. What can they do or what they can expect? As social people, we like to go visit. We visit people, and so vaccinations, fully vaccinated individuals actually plays a much bigger role than you think, and actually will protect a lot more of your inner social circle and family than you think. So these are the three main points that came out. So individuals that are fully vaccinated, they can visit with other vaccinated people indoors with no restriction. What I mean by that is if you as a vaccinated person go to another house of vaccinated people, you don't have to distance and you don't have to wear a mask. That sounds good. That's what we want. That's kind of back to normal living, interacting, socializing. But what does that mean if you get fully vaccinated, but you go to a house that nobody has gotten vaccinated? So if that house of unvaccinated individuals do not have any high-risk medical conditions, healthy, with no risk factors, any indoor activity gathering is advisable, and there's really no restrictions as long as that unvaccinated individual is not at risk for severe disease. No mask, no distancing. And what I thought was particularly interesting was this last guideline that came out. So as a fully vaccinated individual, if you were to be exposed to someone with known COVID, you do not have to quarantine or get tested as long as you're asymptomatic. So that's kind of a big deal, because up until this point of vaccinations, people were like, what do we do? I just met my buddy Joe. He told me, we hung out for a little bit, and I'm vaccinated and he wasn't, and 2 days later he tells me he's positive for COVID. What do I do? Well, prior to vaccination, they would have said, yeah, you need to get tested and quarantined. That's not the case now, as long as you get your vaccination or completed your series. So very different dynamic here. So you, as a vaccinated person, at least being exposed, as long as you don't have symptoms, you don't have to quarantine and you don't have to test. That's that's a important point to understand how that has occurred. Now, I know you've seen this, and it's been updated to include the efficacy of Johnson & Johnson. And I know there's a lot of questions about the variants that are out there, the UK, the South African, the P1, the P1 variant. What is the efficacy? And the efficacy, at least for Johnson & Johnson, it's at least known to be 66% effective against the variants. Now, I think people need to realize that when it came to as a comparison, let's take the flu influenza vaccine. We give that every year, and every year over the last 6, 7, 8 years, its efficacy has ranged anywhere from 25 to 45%. Well, compare that to Johnson & Johnson's efficacy of 66% against the variants. That's still higher than what we've been giving out annually for the flu. So I'm not discouraged by the fact that the efficacy drops when it comes to the variants, because there's still a level of protection. But I think what's even more important when we look at, yes, you can talk about the variants, but I think when we talk about severity of disease of COVID, severity of disease, being sick enough to go to the urgent care or go to the ER, be admitted to the hospital, or even having a fatal outcome, the efficacy in preventing that from occurring is nearly 100% across the board for all three of these vaccines. And that's really the more important point to all of these vaccines. It's not whether or not you're going to get COVID or not. I think the bigger question in everyone's mind is, how bad is it going to be? Well, I think the vaccines, the 3 vaccines that are in the United States now, certainly have the efficacy to prevent that severe disease from occurring. And that's the most important point to take away from all of these vaccines, is that it has that potential for preventing a very high likelihood that, not 100%, because nothing is ever 100%. But still, this is really, really good news, and no one should deny a Johnson & Johnson vaccine because of its efficacy of 72 or 66%, because the ultimate is, can it prevent me from getting too ill or having a poor outcome? So now, what's going on here in Wisconsin and its vaccine effort, 19.1% of state residents of Wisconsin have gotten at least one vaccine. And as you look through the racial and ethnic demographics here, we see that natives who have gotten at least one vaccine, 13.1% of population has received one vaccine, followed by Asians 8.6, Blacks 6.4, Whites 18.1, Hispanics 5.8, and 63% of individuals 65 and older have gotten at least one shot. When we look at completing the series, only 10.8% of the state has gotten or has completed the series. White population 10.3, followed by natives of 6.9, Asians 4.9, Hispanics and African Americans at 2.9. So we as a population, and this really is a testament to all of the tribes and our health center here, of the effort of the vaccines that we've been getting out to our native communities. So just looking at all of these numbers, I know it gets a little busy, but when we look at numbers, when we look at single dose, looking at the demographics of race and ethnicity, I've been following over time, as I presented to you over the last month, what has been the number of individuals who've gotten the vaccine, the change over the past week. So for natives, it's been 2017 vaccines, had new vaccines over the past week. What that percent change is, and I've been tracking the percent change over the last couple of weeks. So as of March 3rd, the change was 20.6. As of March 10th, 23.4% change. So it's increasing, it's steady. As we start looking across other races and ethnicities, how does this break out in comparison? Are groups getting, equivalency of of vaccine to groups? And I think the answer is yes. There has been concerted, concentrated efforts to assure that the minority populations of Wisconsin are getting vaccine that is comparable across the board. And I think you can say that that has been occurring. So that should put any doubt in anybody's mind whether or not this is being equitably distributed to bed, because I think, and the numbers show that it has been. So I wanted to make that point because I'm sure that always comes up as a point of issue, whether or not it is or not. Looking at how vaccines are distributed and the rate of infections, or I'm sorry, as far as the rate of administration of the vaccines, we see as of March 9th, there's been almost 1.8 million doses that have been administered. So that is an average over the past week of almost just shy of 39,000 doses, 39,000 doses per day. And so that's kind of a high watermark for Wisconsin, and hopefully the numbers keep increasing. Looking at what's going on throughout the United States. So this gets a little complicated, but if you look on the right-hand side, you see the people vaccinated, the total number of doses, at least one vaccine, and people who received at least a fully vaccination of 2. They have population-based rates and numbers. So if we look at percent of population 18 years of age or older, at least one dose been given to this at this point, 24.4% of the country, 18 and older, have received at least one shot. Fully vaccinated, 12.9% who have completed the series. We know that our elder population, individuals 65 and older, you can see how their numbers are laid out here. So the percent of population 65 and older, 61.2% of the population has received at least one dose. People who have been fully vaccinated, 31%. So there has been a dedicated effort to assure that high risk, our most high risk population in the country has been vaccinated. You know, at this point it's 61.2%. I had mentioned in the state of Wisconsin, 65 and older, it's been 63%. So in that regard, Wisconsin is doing a little better than the national average. Nationally, we've been averaging 2.1 million doses per day. And when it comes to long-term care facilities, nursing homes, assisted living homes, the federal pharmacy program, the rate of vaccines being administered is actually going down, which tells me that this particular program may be reaching its ceiling to reach out to all of the individuals in this program, which is good. That's what we want. This is the population that's probably been hit the hardest when it comes to infections and poor outcomes. So the fact that it's starting to slow down tells me that they are probably reaching a good majority of individuals. So that is good to at least see how this is playing out. How vaccines are, how they've been going in other states. As a jurisdiction, IHS is one of those jurisdictions. GLIC, as an urban Indian health program, is part of the Indian Health Service, and we have been getting our vaccines through IHS. So when we look at IHS comparing to the other areas, other states in our area, IHS is at number 17 out of 64, Wisconsin's 21, Minnesota 23, Minnesota 42. So all have gone down a little bit, but I think the fact that us as part of the Indian Health Service system, that we are still getting our vaccines in a steady state. And so I'm confident moving forward that we'll be able to continue at the pace that we have been operating at. Just to go through here, and we'll hit some of the higher points. With IHS and the Indian health system, left to right, looking at IHS areas, the total number of tests being conducted, the number of positive tests that are done, 187,827 confirmed cases to date. The level of activity that's been going on from over this past week. So we have the column of change in the number of new cases in the past week. I have 3 areas that are highlighted that have bumped up, not dramatically, but they have taken a bump up. But when we look at it collectively of all of the areas all throughout the country, we see that IHS has at least confirmed that less than 1,000 COVID cases have occurred in the past week. Again, I've been talking about numbers for months, all the way back as far as June. And it really has been since June, since we've seen a number this low. So in Indian country, the numbers are trending downwards across the board. And that is great news, especially with the introduction of vaccines. I think has a big portion, a big portion of why numbers are going down have really been since New Year's. The numbers have been going down, and that's really because IHS has been giving out and distributing vaccines really since December 15th. And every tribe, every federal site, every tribal health center, every urban Indian health program in the country has been getting vaccine and contributing to administering and intervening in the risk of transmission. Looking at how things have been going on in our area, Michigan now has a rate of 5.2%, Minnesota 6.1%, Wisconsin, the number is cut off, but it should read 12.3% of the native population in Wisconsin has now had COVID to this date. So the numbers have plateaued, and hopefully it will level off here now that we're entered. All the tribes, all the health systems here in Wisconsin and in the region are implementing their vaccine programs, that hopefully we won't be seeing this number increasing anymore. Just as a point of interest, when we talk about cases, yes, they're going down, but what about on the flip side of cases? How dramatically are we seeing the reduction in hospitalization? So when I show you this is really looking at regional aspects of the state. We see that there's been, as of yesterday, there's 234 individuals in the hospital right now. What's broken out on the right half of this page is the sections of Wisconsin. So if we look at the Fox Valley, that would include like Shawano, Menominee, Outagamie, Winnebago, those counties. Only 9 people are actually in the hospital with COVID right now. 9. In the southeastern part of the state, that's down here in like the greater Milwaukee area, 111. So, 234 compared to, just a short 2.5 months ago, we were talking about over, 1,300, 1,500 patients in the hospital on any given day. You can see the trend and the drop in the cases, not just in cases of overall cases, but cases in the hospital as well. And so, again, the dramatic drop is a trend that is continuing. And hopefully this trend with all the vaccines that are going on will continue. Looking at what the average 7-day average over the last 7 days for Wisconsin, 388 as of yesterday. In comparison, when was the last time we were seeing 388 cases a day. June 27th. That is the closest time when we have been this low in the number of cases. So it's been a while, and hopefully this will continue. So some evidence to support the effort of assuring that individuals or elders kind of take that priority of getting vaccines. I think the data now clearly shows that the efforts that not only the state, but also the efforts that we took in assuring 65 or individuals over 65 with high risk conditions were the priority to vaccinate. So as we look at the state's numbers, when we go by date, the top row, February 24th, March 3rd, March 7th, these are week intervals, 3 points in time, and looking at the rate of infection, especially 65 and older, the rate of hospitalization, admission to the ICU, and the fatalities. So as you go and you look at each category, you see that not only are the overall numbers decreasing for all age groups, but we see that the rate of decrease for the 65 and older are going down as well. Same with hospitalization. So fewer individuals 65 and older getting COVID, fewer are being admitted to the hospital, fewer are being admitted to the ICU, and the fatality, not only the number, but also the rate of fatality is also decreasing. So these are 3 points in time. They're not huge leaps and bounds, but again, you're seeing the numbers, they are trending downwards. 3 points in time, 21 days, and clearly showing signs that the effort of vaccinating individuals of priority risk is definitely having an impact on the rates of infection. So Mark and Jeremiah, I'm going to turn this back over to you guys, and we can have a discussion about anything that's coming.
Great, Dr. Ignace. Thanks for having a good 20 minutes so we can talk about this. We are in our new format doing an hour program, and we try to stop at the top of the hour. We do have one question that came in on the chat. It's a good one, and it says, Dr. Ignace, do you know if the J&J, I assume that's Johnson & Johnson vaccine, made its way into the Indian health distribution programs and clinics? Are they in clinics now? Are they coming? What do you know?
What I know about Johnson & Johnson, we've gotten direction from our higher ups that Johnson & Johnson will not be distributed within the Indian health system for the month of March. Now, that changes, information changes all the time, but as of right now, IHS will not be seeing Johnson & Johnson. Now, that's not to say that there may be locations, there may be tribal health services that are getting Johnson & Johnson, but they may not be getting it from IHS. They may be getting it from the state. So just so there's no confusion, IHS systems, hospitals, facilities, entities, that we have options in how we want to get our vaccine. We can get the vaccine directly from IHS, or we can get the vaccine directly from the state, but you can't get both. It's either one or the other. We went with IHS. There are other tribes and health entities that may be going through their state. The states may be getting their allotments, and so there may be areas that are getting Johnson & Johnson. I just know people who are getting vaccines from IHS will not be getting Johnson & Johnson for the month of March.
Hearing what you're saying, so two questions building off of this one. you did get aid from the state to get these vaccinations out there. Does that mean then that when you were vaccinating people over these past few days and today for sure, in none of those cases were you giving Johnson & Johnson vaccinations?
That is correct.
Okay. So the reason I ask is when I went to the health center, like lots of other people did over these last 3 days, you kind of sat down next to me. I hadn't seen each other personally for quite a while. And across from me, I see the faces of young students, Indian Community School students who had graduated ICS and followed kind of our daughter's footsteps over to University School in Milwaukee. That was awesome. On my left-hand side, I saw a young man who is best friends with one of my sons. And there you were. And I know a lot of the people that are in the room. And then in the room comes another buddy of mine. And I think you were there and you heard him kind of yelling. So this is coming to a question, and it's going to sound insensitive, but it was said.
Yeah.
It's on people's minds. And what he said really loudly coming in. And I talked to him later in the parking lot, say, hey man, come on. And what he said was, hey, I want to know right now before I go through with this, that you're not giving me the vaccine that the blacks are getting. I want to get the vaccine that the whites are getting. So I asked him, man, where'd you get this from? And he said, well, I live in a African-American neighborhood. And in that community, they're talking. And when I talk to them, because we all talk, we're all neighbors, the idea is that people in poverty, people of color, will be getting a vaccine that is less effective and doesn't work as well as the other vaccines that people are getting. So we've dealt with this question in different ways, but it continues. So that's why I'm asking. You were there, you heard a part of that. And again, apologies to those watching, not meaning to be inappropriate, but it's kind of what it comes down to sometimes. We need to make this person-to-person connection on this information. Dr. Ignace.
Yeah, so there is not a difference between the vaccines. So what we are giving, and to tell you the truth, right now, Johnson & Johnson is just starting to get out of the gate in terms of getting out into the circulation. So up until this point, it really is either you get Pfizer or you get Moderna. Either one have great efficacies, not just against the virus, but also in preventing and transmitting. And ultimately, real world numbers here are showing that it has a very high success rate in preventing and transmitting and preventing severe disease. So that the whole notion about whether other communities are getting a lower efficacy, well, I think a real discussion about the ultimate metric here of how these vaccines work and what the goal is. I think everyone can be rest assured that at the end of the day, all three vaccines are going to have the same effect in preventing severe disease, regardless of which one you get. You are still going to have the same level of protection, transmission, and prevention.
A couple of questions I've gotten over. Well, one came through a class that I was having, a student, young Native student. It was an interesting question, two-pronged. One was she couldn't remember if it was that if you got the vaccine, that is the same as birth control, and or should she not be thinking about getting pregnant at this time if she gets the vaccine? I thought those were interesting perspectives, ones I never thought of. So handing it over to you. Is the vaccine a birth control vaccine? And what about pregnancy or women that want to get pregnant and they're getting the vaccine now?
Yep. So, there are phases, clinical trial phases that are still ongoing, in particular, whether or not younger population, pediatric age population that trial's still ongoing. They haven't completed it. The other one is still looking at the expected mothers or current pregnancy and whether or not it's safe. CDC has not come out officially yet. Now, if we're looking at, let's say, yeah, I'll forgo that, I'll waive that, and I'll still get the vaccine, is there going to be a level of protection for myself and my expected young one? So the answer is yes. If you were to get the vaccine and your body was to develop antibodies, these antibodies just don't circulate in you. The blood supply that you offer to your to the baby is still one system. So it does, the antibodies that mom would make do transfer over into the baby and does provide a level of protection. So that is what is known. That is what is to be expected. And I think once we hear about kind of the final decision from the CDC and how this is going to be approached, I don't think there should be any hesitancy. It is not a birth control. And you still can get pregnant even before or after if you decide to get the vaccine. So I don't think it should be a point of contention whether or not you should or should not, if that's what you are anticipating to get pregnant.
Another concern that came across was someone in that vaccination line, and that is, it came after seeing them connecting with information, and the question came this morning, is they got a back to work order in person, and that when they come back to work, that they're going to be testing for COVID-19. I don't know what that test looks like. I don't know how that is. So this person got vaccinated, a couple days ago.
Mm-hmm.
Will they test positive for COVID-19 on a COVID-19 test? If they do, how long does that go? Or do they not have to worry about it?
Well, so these vaccines, they're not 100%. They have a very high success rate of prevention of getting COVID, but we've seen a couple times now where people who've gotten their first dose, within a week they've come down with COVID. It's not a lot, and maybe 2 people that I know who've gotten the first dose vaccine have actually come down with COVID. And that's I don't think anyone should be surprised by that. They shouldn't be surprised, because we know even after the first dose, it takes 10 to 14 days for your body to fully respond, or at least develop a good response into prevention. And what I mean by that is that it takes that long for your body to start making antibodies and provide you that level of protection. So if you get COVID within the first week after getting the vaccine, yeah, that means you were exposed before you even got the vaccine. The vaccine did not give you COVID. And so there is that risk, and we've seen that. And that's why there's this guidance to continue providing your personal protection, hand sanitizing, distancing, mitigation, social distancing, and mask wearing. And because we know that even after that first dose, you can still get it. In that first 2 weeks after the first dose, and even after the second dose, those are the critical times where you still want to maintain that level of protection. So you won't be fully protected until 2 weeks after your second shot.
The next question is about COVID-19, and the person had COVID-19, recovered, good news. But then seeing everybody getting vaccinated was like, well, I don't know if I should sign up. And then they didn't want to take someone's place, so they didn't even ask.
Sure.
Last time they had COVID-19 was about 3 weeks ago. So question is, you're talking about a next time And not that you know when that next time is, I'm sure you'd like it to be sooner than later, but for this person or other people, once you've had COVID-19, should they wait on getting a shot? If they do, how long? Or do they not have to worry about getting a shot at all?
So right now, this is being actively studied and researched, but studies that have come out before the vaccines have shown that there was always this question of level of natural immunity. That is, before vaccines, when I get infected and recover, how long does my natural immune antibodies protect me? And in the beginning, it was like, hey, it only lasts a couple weeks. Then it became, then it lasts 3 weeks. And then now it lasts 6 weeks. And that's really because this is such a novel disease. We're learning as we go. But what we're finding out are individuals, even after 6 months, still have 85% of their natural antibodies present 6 months after infection. So that is still a very good level of protection. Now, I know CDC has come out and said, yeah, everyone who's gotten COVID should get vaccinated, but they truly didn't come out and say, yes, absolutely. Well, in the beginning, we're still dealing with demand and supply. And so when we look at individuals and say, well, two people of the same age, let's say they're 60 years old, one had COVID 3 months ago, the other person hasn't had COVID, you only have one vaccine shot. The question is, who do you give it to? And I think the answer is pretty simple, is who you give it to is the one that hadn't gotten COVID. Now, that's not to say the person who did have it can't have the vaccine. It's just, how do we maximize our response of protection to a broader population? And it's trying to increase the number of individuals. And this goes back to herd immunity. When we talk about herd immunity, it is the individuals who've either had the infection or the individuals included with the vaccine. So you want to have both in your population. Now, I'm not saying you deliberately want people to get COVID, but what I'm saying is people who've had COVID, they have their natural immunity. You want more people to get to that herd immunity, you have to vaccinate, which means you have to vaccinate the non-COVID people to get to that herd immunity level. So to circle back, when should someone who's had COVID get a vaccine? I'm saying 3 months and 3 months plus. And that's what we're going by right now.
The next question, and I think maybe we got time for a couple more, depending. So this person is an anti-vaxxer, even though they got vaccinated as a kid and got their kids vaccinated. Mm-hmm. Not this one. That's not them. Boy, they're going to wait for herd immunity.
Oy.
They want to get surrounded by that. I don't forget what the number is. Maybe you can help refresh our memories of 70 or 85% or of the population. Well, now there's herd immunity. Now I can go around without my mask, no vaccination, and I'm going to be just fine. What can you say to that person?
Well, let's say there's no vaccine, when can we expect to reach herd immunity? Well, I guess that would depend on how quickly or how long do you want to delay it. If based on the contagiousness of this particular virus and to reach herd immunity, this particular virus, it's been reported out anywhere between 70 and 90% of the population has to have COVID. Either get it directly or by vaccination. Now, let's say we never had a vaccine. Well, we could delay this a very long time. We could delay this for another 18 months if we wanted to do it without a vaccine. Or we could do it really quick, which wouldn't be advisable. We could all get it all at the same time. It's kind of like individuals who go to these chicken pox parties. We can all get it all at the same time. We can establish our own herd immunity that way. Not advisable. Now, with the introduction of vaccines with the individuals who had COVID, we can expedite that, and it really depends on the rate of vaccination. So either we could take the slow boat, really slow, and prolong this out for a very long time, which I don't think anybody would be in favor of that. Or we could go with the vaccine route and safely do this amongst a population of 335 million in relatively short order. I don't agree with the anti-vaxxers approach. It's in a society as a whole, functionality doesn't work.
So last question, and we're at the 4 o'clock hour.
Did that answer your question?
It got close. It got close. So what I'm saying, the point of this person is, I'm going to wait for herd immunity.
Okay.
Pretend like it's not even like, and just wear my mask, go do all the right things, and then once it's there, then I can go out in the world and it's just fine. And my point, because we did bring this up before, is it doesn't mean that COVID-19 went away. It means that there's vaccinations and people that had it and they can fight it off a little bit better than others. But for you, you're just as vulnerable then as you are today. Because that vaccine might still be in our population just because it says 85, 90% herd immunity. Doesn't mean you won't get it.
True.
You know,
I mean, it's a long gamble. It's a long gamble.
Okay.
And I'm not just thinking of a individual themselves, but if we're talking about families, social events, gatherings, our elders, our aunts and uncles who may be at risk, you know, that's a bad probability I would not want to play.
All right, Dr. Ignace, it's 4 o'clock. I'm going to roll that last question over to our next program. It's into week 51. Because
you sure? We got time. I can answer one more.
All right, here you go. You know, here it is. And this one directly to you. It even has your name attached to it. That Dr. Ignace, you know how he got those 460 vaccinations now? Because we didn't know about those other ones. He did it because he paid for those vaccinations by giving up all the other programming that the health center does. No more wolf program, no more mental health program, no more even employees going to be getting laid off because you want to be a cowboy, to use a word, and get those extra vaccinations out. I thought that was interesting. And so there you go. There's your question. Native. Did you kill all those programs so more people could get vaccinated?
No. In fact, we haven't paid a single penny for the vaccines. Your tax dollars did. So I didn't pay for it. We didn't compromise anything. I mean, we've cut back on some of our programs just because of the pandemic. But we didn't sacrifice any revenue that goes to these programs to vaccines. These were contributed from the states. They were contributed through our effort here that we get through IHS. We combined our effort to provide the vaccine. So we didn't cut corners on anything. We didn't compromise any programming. And once there is a level of comfort, all of the programming, if not more programs, are going to come out as a result once we get to a level of safety.
We're going to go over to Jeremiah.
I had to pay for those vaccines. I'd be broke.
So Jeremiah's going to help you with this last. He weighed in, and I'd like him to weigh in personally on this one. And my hope too is that one of our future programs, we're going to be having to deal with some mental health, unresolved grief in our community, because we've been hit so hard, and we're going to continue to be hit hard for a few weeks here. Takes a little bit for these vaccines to kick in, and for us to regain a lot of that trust. And that means for every one of us out here that has got a vaccine, own it. Don't be afraid to say it. Share that with your friends and say, look, this is what happened, and be real. Don't hide anything from them. So I'm just going to turn this one over to Jeremiah. You're going to have that last input, and then we'll go to Dr. Ignace. And I think he had something to say about the Wolf program, Jeremiah. Can you tell us what that is and what you know about it right now?
Yeah, sorry, I heard that part and I just wanted to chime in. I know, from a standpoint that I work pretty closely with the Wolf program as far as the coordinators, and from a standpoint of people that they've been able to reach, prior to COVID was about 15 people per week that came into the clinic, got a meal served, and now that ranges from anywhere from 30 to sometimes 50 people that they are reaching on a weekly basis with a freshly cooked meal, and other programming inclusions as well. So, and not to mention, the mention of, yes, obviously programming within the clinic has changed because of, as Dr. Ignace mentioned, safety restrictions and whatnot because of the pandemic. But overall, the amount of stuff that we've been able to continue to do virtually and still reach our patient population, I think has been a testament to, Dr. Ignace and just our staff in general.
Thank you, Jeremiah. Dr. Ignace, you have the last word for today, and thank you for everything, and to everybody at the center. Amazing work, and I have to say, to see all of those stations, all of the print media that was on this. I mean, people need to remember out there, we're some areas we're less than 2% of the population. And when people on the news say it bleeds, it leads, or they're trying to reach a larger demographic, that demographic doesn't include us. And for something worthwhile to hit the airs about our population in that short of time, I cannot remember the last time that was done, if ever. And I even saw an anchor newswoman put on a beautiful dress and wore so much turquoise, I thought I was in New Mexico. So I think she was sending a message out there of love and support to us. So, much love to her, and thanks for that subliminal message. That was very cool to see someone do that. That was awesome. So, Dr. Ignace, you have the last word. Thank you.
Thanks, guys. This has been a really important week, and it hasn't gone unnoticed, as Mark was speaking to. And I know there's a lot of people, there is a demand for the vaccine. We are trying to work the logistics and the coordination, so be patient. We will be hosting another event in short order. I won't say the date yet, but it's sooner than people think. And we'll have information out as early as tomorrow. So be patient. If you registered online, believe me, you are going to get a call back, and we are going to make sure that you have an appointment and set up for the next round of vaccines that we do. So, stay tuned, and we will follow up and make sure that people have the information that they need, where and when, with a date, and how they can get their next shot. So until next time, stay strong.